is Faith. I'm going to be your nurse. Could I have your name, please?
Matejik, March 986.
Perfect. And your date of birth?
You
already said your date of birth. Sorry
That's
about
okay.
that. So, what brings you in today?
I just came for a routine check.
Oh, perfect. Okay. So with the routine checks, we kind of just go from head to toe assessments, okay?
Okay.
I'm
I'm gonna take off my.
Perfect. All right. And you said your name was Azza. Is that the name you prefer to go by?
Yes.
Perfect. Any pain today?
Not really.
No.
No.
Perfect. So 0.
Yeah, 0.
Okay.
0 out of 10. Yeah.
Perfect. All right. So I'm going to start with your scalp. I'm feeling for any divots, any bumps, lumps, any tenderness when I'm doing this?
No.
Okay. All right. And then I'm just feeling your ears as well, the auricle, your earlobes, and your mastoid process, your tragus. Any tenderness when I'm doing that as well?
No.
Okay. I felt soft, nothing hard or anything, so that feels good. All right, so now I'm just gonna palpate your tonsils. It shouldn't hurt. If you do feel any tenderness though, let me know, okay?
Okay, sure.
So I'm gonna start with out back, so the occipital, and then moving forward to the post-auricular, and then the pre-auricular, the parotid, the tonsillar, submandibular, submental, your anterior cervical, posterior cervical, and your supraclavicular.
Okay.
All right, those feel good and no tenderness. Would you mind shrugging your shoulders for me? Perfect. All right, I'm looking at your skin. Everything looks great. No bumps, no dryness. So that's what we want to see.
Thank you.
Yes. Okay. So I'm just gonna grab my light so that I can just take a look. Would you mind opening your mouth real wide for me? Say ah. Perfect. Would you mind just moving your tongue side to side? Great. All right. And soft palate's intact. Uvula is midline. Mucous membranes are pink and moist. No lesions, so that's what we want to see. All right. Now I'm also, while I have my light, I'm just going to take a look at your pupils. Okay. So I'm just going to see how they accommodate to light. And so your pupils were equal, round, reactive to light, and they did accommodate back to their normal size after, so that is good. And then I will just check your corneal light reflex. So just take a look at my nose. Perfect, those are equal. That's on both eyes, which is what we want to see. So now I'm just going to check your cardinal field of gaze. So what you're going to do, you're going to follow my finger, but try not to move your head, okay?
Okay.
Awesome.
Okay.
Okay. I'm just gonna move down, just looking at your skin. Any tenderness?
No.
No edema, anything like that? Perfect. All right, so now I'm just gonna feel your radial pulses.
Okay.
Yep. All right, they are equal bilaterally, which is what we want. Squeeze my hands for me. I'm just checked in
Okay.
your so the neural reflexes and your grip strength, which is good.
Okay.
Just gonna check your capillary refill.
Okay.
Which is good as well.
Okay.
I'm going to palpate your carotid once at a time. So I'm just looking for any jugular venous dissension, which there isn't any. I'm just going to auscultate real quick, listen for any turbulent blood flow. Perfect. I don't hear anything, which is what we want. All right, so now I'm just going to listen to your heart, okay?
Sure.
All right, so I'm going to start at your second intercostal right sternal border, and that is where you'd hear your aortic valve. And with this, you're going to hear your S2 sound louder than your S1. And the pulmonic, which is your second intercostal left sternal border, you're going to hear the pulmonic, and that your S2 is going to be louder again than your S1. Then you're going to go to your third intercostal left sternal border, that's the Erb's point. Your S1 and your S2 are going to be equal. Then you're going to go to your tricuspid, where you're going to hear the tricuspid valve. And with that, it is the fourth intercostal space, left sternal border, and your S1 is going to be louder than your S2 here. And then your fifth intercostal space, midclavicular line, that's where you hear the mitral And with that, again, your S1 is going to be louder than your S2. Then I'm just going to listen to all those same points with the bell. With that, I'm just listening for any murmurs, any turbulent blood flow. Okay. All right. So, didn't hear any turbulent blood flow, no murmurs, which
Okay.
is what we want. So now I'm just going to move to listen to your lung sounds, okay? There's going to be
Sure.
6 up at front, okay? So take a deep breath for me. Perfect. And again. 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 Perfect. Would you mind just lifting your arms up a little bit for me? All right, so I'm just listening to the side. Would you mind taking a deep breath? And again. Again. And again. Awesome.
Okay.
Now I'm just going to listen to the lung sounds on your back, okay?
Sure.
Alrighty. Again, another deep breath. Again. Okay. Alright, so what I'm listening is your bronchial sounds up here. And with that, you're gonna hear your expiration louder than your inspiration. Then I'm moving down to, would you mind taking another deep breath? Perfect. So this is bronchiovesicular. In this space, your inspiration is gonna be equal to your expiration. Alright, and then this last part, take a deep breath for me. Alright, another deep breath. And this last part, the vesicular, the inspiration is actually louder than the expiration.
Good.
And then just one last big deep breath for me. Awesome, so I'm just looking at chest expansion. I was equal bilaterally, so that's what we want. So now I'm just gonna palpate on your back. It's called CVA tenderness. We're just checking for any kidney tenderness, okay? So let me know if it hurts.
Oh, doesn't hurt.
No?
No.
Okay, any painful urination, anything like that lately?
No, so far.
Okay, good. So I'm just gonna have you lay down so I can listen to your abdomen, okay?
Yeah, sure.
Awesome. Alright, and when was your last bowel movement?
Today in the morning?
Okay, have you been passing gas?
No.
No? Okay. Alright, I'm just gonna listen. I'll listen to the 4 quadrants,
Sure.
and I'll listen for 5 minutes, up to 5 minutes if I don't hear anything.
Oh, okay.
Alright. Sorry, my hands are cold, I
No, that's
apologize.
okay.
Perfect, and those are active bowel sounds. That's what we want. I'm just gonna palpate your abdomen. Any tenderness?
No.
Okay, awesome. Alright, I'm just gonna listen with the bell for your different arteries in your abdomen. So we want to listen, we listen for the bell to hear any bruits, any turbulent blood flow. So we hope not to hear
Okay.
anything. So the aortic, renal, femoral, iliac, on both sides. Don't hear anything, which is what we want. So that's good. Alright, now I'm just gonna feel your legs. Any tenderness at all? No. Okay, there's no edema, which is good, which is what we want. Looks like there's equal distribution of hair.
Okay.
So that's good. That means there's good arterial perfusion, there's no edema, so that means
Okay.
there's no venous pooling, which
That's
is
good.
good. Alright, so then I'm just gonna listen to the posterior tibialis, dorsal pedis. Perfect. And those are equal bilateral, which is what we want. That means there's good perfusion on both
Okay.
sides. I'm just gonna check your capillary refill. Good. Awesome. Skin is nice and smooth, no cracks, anything. So lastly, just push down on me. Awesome. Push up. Alright. Awesome. So could you sit up and swing your legs over to the
Okay,
other
sure.
side? Okay, so I'm just gonna check your reflexes, okay?
Yeah.
Oh, sorry. There you go.
Oh,
And here.
yeah. I felt
Okay.
it. Yeah. Okay.
Okay. So, um,